Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid, Rashid. Today's topic is maxillary sinuses, free medical education. The paranasal sinuses. They are air-containing cavities in the bones around the nose. There are 4 pairs altogether, 4 in number on each side of the skull. This is anterior view of the skull. This is left lateral view of the skull. We have 4 pairs of paranasal sinuses. This is frontal sinuses, which are high up in the frontal bone. And next is sphenoidal sinuses. It is in the body of the sphenoid, far deep inside. Next is ethmoidal sinuses. They are in the lateral mass of the ethmoid bone. On each side, 3 groups of air cells, anterior, middle, and posterior. And finally, the maxillary sinus, which is the lowest but the biggest in the body of the maxilla. So if you see from lateral side, this is the frontal sinus, high up in the frontal bone. This is the sphenoidal sinus, far back in the body of the sphenoid. Ethmoidal sinuses, 3 groups on each side, anterior, middle, and posterior. And maxillary sinus, the lowest but the biggest and most clinically important inside the body of the maxilla. This is the anterior view of the skull. We are going to discuss about the maxillary sinuses. This is zygomatic bone. This is maxillary bone. This is zygomatic process of the maxilla. This part is the body of the maxilla. Maxillary sinuses were first reported in 1651 by Nathaniel Haimo, and thus it is also known as antrum of Haimo. It is the largest of the paranasal sinuses, occupies the body of the maxilla. Its shape is a 4-sided pyramidal shape, consists of a base, an apex, and 4 walls. Base, apex, and 4 wall. Maxillary sinus continuation is the enlarged maxillary sinus. Look here at the picture. In the picture, this is the base of the maxillary sinus. This is the apex of the maxillary sinus. Base of the maxillary sinus is directed medially towards the lateral wall of the nose, and its apex is directed laterally into the zygomatic process of the maxilla. Base is directed medially towards the lateral wall of the nose, and apex is directed laterally towards the zygomatic bone. It is often enlarged and the apex extends laterally into the zygomatic bone. You can see in this picture. Walls of the maxillary sinus. The maxillary sinus is a 4-sided pyramidal shaped cavity which consists of a base, an apex, and 4 walls. First is the base. This is red color. Number 1, this is the base. This is the base of the maxillary sinus. It is directed medially related to the lateral wall of the nasal cavity. The second is the apex. This is the apex. Apex is directed laterally towards the zygomatic bone, often extend into it. 3. This is the superior wall. Superior wall or roof of the maxillary sinus is the floor of the orbital cavity. Infraorbital nerve and vessels traverse through the roof of the maxillary sinus. Next is number 4, inferior wall or flow of the maxillary sinus. This is the one inferior wall or flow of the maxillary sinus. It is the alveolar part of the maxilla. It is about 1 to 1.25 centimeter lower than the flow of the nasal cavity. It is closely related to the roots of the upper molar and premolar teeth. Next is anterior wall. This is the one anterior wall. It is the facial surface related to the cheek. Next is posterior wall. This tiny little space, number 6, is the posterior wall, facing posterior and related to the infratemporal and pterygopalatine fossa. Maxillary sinus has a capacity of approximately 15 mil in adults. The opening or ostium of the maxillary sinus is high up in its base. We are going to see this one in next slides. Structures related to the base of the maxillary sinus. We are looking at the base of the left maxillary sinus from lateral side. This is anterior. As you know, the base of the maxillary sinus is directed to the lateral wall of the nasal cavity. We have already mentioned. This is superior border of the base. This is anterior border of the base. This is inferior border of the base. And this is posterior border of the base, which is about 29.3 to 56.9 millimeter. The maxillary ostium, that is the opening of the maxillary sinus, is at the upper part of the base. This is the upper part of the base. It is commonly, that is in about 68%, opens into the posterior half of the hiatus semilunaris of the middle meatus. In front of this is nasolacrimal duct, through which the tears from lacrimal glands will pass down into the nasal cavity, that is inferior meatus of the nasal cavity, not into the maxillary sinus. Distance of maxillary ostium from the roof is 1.3 millimeter, and distance from the nasolacrimal duct is about 4.5 millimeter. The size of the maxillary ostium is about 6.8 into 2.1 millimeter. It is oval in shape. Where does this nasolacrimal duct open? As I have said earlier, it is not into the maxillary sinus, but it is into the inferior meatus of the nasal cavity. Flow of the maxillary sinus. Let's see the diagram. This is the left lateral view of the skull with maxillary sinus. This is anterior. This is the flow of the maxillary sinus. The flow of the maxillary sinus is the alveolar part of the maxilla. Below that, we have roots of the molar and premolar teeth. It is about 1 to 1.2 centimeter lower than the flow of the nasal cavity. That is, flow of the maxillary sinus is about 1 to 1.25 centimeter lower than the flow of the nasal cavity. It is very closely related to the roots of the upper molar and premolar teeth. So what is the thickness of the flow of the maxillary sinus, which is related to the roots of the teeth? The thickness of 0.5 millimeter, that is half a millimeter over the roots of the molar and premolar teeth are, in first premolar is 5%, second premolar is 20%, first molar is 27%, second molar in 46%, and third molar in 30%. So that means molar and premolars are very, very closely related to the flow of the maxillary sinus. Ostium, opening of the maxillary sinus. Let's see the diagram first. We are looking the medial surface of right lateral nasal wall. This is in front. Let's identify few structures. This is middle turbinate. This is inferior turbinate. The space or passage under the middle turbinate is middle meatus. The space or passage under the inferior turbinate is inferior meatus. This bony prominence in the middle meatus is ethmoidal bulla. Below the ethmoidal bulla is semilunar shape, gap is there, called hiatus semilunaris. It is connected anteriorly with ethmoidal infundibulum. So where is the opening of the maxillary sinus? Maxillary sinus opening, that is maxillary ostium, is commonly, that is about in 68%, it opens into the posterior half of hiatus semilunaris in the middle meatus. So this is hiatus semilunaris. Maxillary opening is in the posterior half of hiatus semilunaris in about 68%. So this is inferior meatus. Another opening is here. This is the opening of the nasolacrimal duct. Just now we saw this one in the base of the maxillary sinus, anterior to the maxillary opening. Ostium of the maxillary sinus, direction and position. Direction of the ostium of the maxillary sinus is slight posterior in 18%, slight anterior in 82%. Position of the ostium is in hiatus semilunaris. However, 68% is in posterior half, 26% at the middle, and 6% in anterior half of the hiatus semilunaris. Relation between the maxillary ostium, that is the opening of the maxillary sinus, and the uncinate process. This is coronal section of the nose. This is inferior turbinate. This is middle meatus. This is uncinate process. This is opening of the maxillary sinus. This is another diagram. This is middle turbinate and this is inferior turbinate. This is middle meatus. This is hiatus semilunaris, which is partially covered by uncinate process. As we all know that maxillary opening ostium is commonly in the hiatus semilunaris. If the uncinate process is higher, definitely it will cover the ostium of the maxillary sinus. In such case, removal of the uncinate process is the first step of endoscopic maxillary sinus surgery, and thus why the anatomy of the uncinate process is so important. Clinical correlation of the maxillary sinuses. Maxillary sinuses are the largest paranasal sinuses and they are most commonly infected. called sinusitis. It is due to many factors. Maxillary sinuses are located at the lowest level, inferior to the other sinuses, and even its floor is much lower than that of the nasal cavity. Therefore, the drainage from the other sinuses and from the nasal cavity very often flows into it. It acts as a secondary reservoir for the mucus from other places, which could be infected mucus and pus. Its floor is extremely thin, which forms the roof of the mouth. Therefore, infection can spread to the maxillary sinuses from below through the roots of the carious upper molar and premolar teeth. It is also common in cases of oroantrum fistula, that is abnormal communication between the oral cavity and the maxillary sinus after tooth extraction. Furthermore, the opening, that is ostium of the maxillary sinus, is located high up on its basal surface, related to the lateral wall of the nose, and the opening is very close to the roof. Thus, it is very unlikely to have drainage by gravity as in other sinuses. Infected mucus is thus collected and leads to sinusitis of the maxillary sinus. The end, illustrated and presented by Dr. Hamid Abdul Rashid. Free medical education. See Anatomy DAHAR series, Paranasal Sinuses, Blood and Nerve Supply, Embryology and Functions. For the benefit of the future users, the author welcomes short comments and suggestions from the readers. Thank you.